Hi everyone, and welcome to Health Me Please, the YouTube channel where you can find reliable and up-to-date information about diseases, treatment, and prevention. Welcome back to our discussion on intracerebral hemorrhage. Spontaneous intracerebral hemorrhage, or IC, is a type of stroke caused by bleeding within the brain. Underlying causes. IC occurs when there is an injury to the brain's parenchyma, which can happen due to the expansion of a hematoma or the development of perilesional edema. Additionally, there can be secondary injury to the brain as a result of the breakdown of the blood-brain barrier. Some of the most common conditions associated with IC include hypertension, cerebral amyloid angiopathy, and ruptured vascular malformations. Other potential causes of IC include cerebral venous thrombosis, vasculopathies, primary or metastatic tumors, and coagulopathies. Risk factors. The major risk factors for spontaneous IC include older age, hypertension, and the use of antithrombotic therapy, which can include both antiplatelet and anticoagulant medications. Presenting signs and symptoms. The signs and symptoms of IC will vary depending on the location and size of the hemorrhage. Patients typically present with an acute onset of a focal neurologic deficit, such as hemiparesis, aphasia, or visual impairment. These symptoms will correspond to the part of the brain that is affected. Additionally, patients may experience headaches, vomiting, and a decreased level of consciousness if the hemorrhage is large. Some patients may also present with stupor or coma due to associated reversible causes, such as acute metabolic derangements or seizure. Initial diagnostic imaging. In order to confirm the diagnosis of IC and exclude other possible causes of symptoms, neuroimaging with head-computed tomography, CT, or magnetic resonance imaging, MRI, is mandatory. Both CT and MRI are considered first-choice imaging options for the emergency diagnosis and assessment of IC. CT angiography may also be performed along with a non-contrast head CT to help identify an underlying vascular cause of the IC. Predictors of hemorrhage growth. There are certain predictors of hemorrhage growth that are associated with neurologic deterioration. These include a shorter time from symptom onset to initial imaging, initial IC volume, antithrombotic medication use, and imaging signs of IC heterogeneity on non-contrast CT or focal contrast extravasation on CT angiography. Subsequent imaging evaluation. After the diagnosis of IC has been made, additional imaging may be warranted in the event of clinical deterioration to evaluate for IC expansion or rebleeding and to document that the bleeding has stabilized. Additionally, follow-up imaging may be obtained when an underlying cause is suspected by clinical features or initial imaging findings in order to help guide preventive measures to reduce the risk of recurrent hemorrhage. Brain MRI with contrast is the preferred modality to help identify the underlying cause of IC for most patients. Vascular imaging, such as CT or MR angiography or digital subtraction angiography, may also be performed when an underlying vascular lesion is suspected. Thanks for watching. If you want to stay up to date with all of our latest videos, make sure to hit that subscribe button and turn on notifications so you never miss an update. Finally, we want to remind you that the information we provide on this channel is for educational purposes only. If you have any symptoms that you suspect may be related to a particular disease, it's important to see your doctor as soon as possible.